So I want to share some of the work that we've been doing to lay a foundation for establishing medical legal partnerships in health centers in North Carolina. So before I begin, I did want to introduce my organization. I'm part of the North Carolina Community Health Center Association. We represent 34 federally qualified health centers around the state. And the mission and vision of our organization and the goals of our organization really guided our efforts in helping to address social determinants of health and in pursuing medical legal partnerships in community health centers. So I know that this isn't news to anybody in the room today, but vulnerable patients often report poor health status, and this can be attributed to medical as well as non-medical causes such as suboptimal nutrition, substandard housing, stress. But everybody deserves the opportunity to be healthy. And through medical legal partnerships, we can assemble a team of professionals that can address both the medical and emotional needs of individuals as well as the social and environmental needs. So in the healthcare field, when we think of potential partners for addressing social determinants of health, legal services organizations probably didn't make it to our shortlist, at least not until recently. But the legal system does hold the key to addressing many social determinants of health by helping to ensure that public policies meant to protect society's vulnerable are actually implemented and enforced appropriately. So the figure on this slide shows a couple of opportunities for legal intervention that can help improve social determinants of health as well as overall health status. Recognizing that the legal system holds the key to addressing many social determinants of health, medical legal partnerships have emerged in clinical settings around the country. The first partnership was formed in Boston in 1993, and now there are nearly 300 nationwide. In a medical legal partnership, frontline clinic staff are trained to screen patients for health-related legal needs, things like improper denial of insurance, and then refer to a legal team when indicated. And then the lawyers can then intervene on behalf of the patient and at no cost to the patient. Lawyers can become integrated into the healthcare team and supplement the work of social workers and case managers. And medical legal partnerships also have an opportunity to address some of the more structural and systemic issues in communities. In North Carolina, we currently have 12 healthcare institutions that have partnered with a legal partner, and in 6 communities across the state, and there are 4 community health centers with current medical legal partnerships. And we really feel that medical legal partnerships and community health centers make a lot of sense. They're a good fit, in large part because of who community health centers serve. In 2011, 52% of patients in North Carolina's health centers were uninsured, 75% had incomes below 100% of poverty, 95% had incomes below 200%. So given that they care for a more vulnerable group, health centers have developed a range of services we call enabling services to help facilitate access to care and to help address the broader socioeconomic needs of their patients. So these are things like outreach, case management. Laura talked about a lot of the services they provide at their health center, transportation, for example, and feel that medical legal partnership could be another type of enabling service that community health centers can offer. So in order to make the case for developing medical legal partnerships, we collaborated with Legal Aid of North Carolina to develop a pilot study of sorts and measure unmet legal needs among health center patients. And we wanted to collect this information in order to bring attention to these needs and also to encourage more communities to develop medical legal partnerships. We also wanted to collect the data in order to inform future program planning and operations. So we created 2 survey tools, a pen and paper administered survey tool for patients that was available in Spanish and English. And then we also created a survey for health center staff, and that was web-based. On the patient survey, we asked folks what types of legal and resource needs they experienced over the past year and to indicate their willingness to discuss those issues with a provider. And on the staff survey, we asked individuals what issues they thought were most important to their patients and to indicate their likelihood or their comfort level discussing those issues with patients and their likelihood of screening and referring if they knew that there was an established referral program that would connect patients to free legal services. So we targeted 5 health centers across the state for participation. We tried to achieve some diversity in location, size, MLP implementation, and we also targeted health centers that emphasize enabling services. We collected data over about 6 months and then spent several months undergoing data analysis. So overall, we got 334 patient surveys and 207 staff surveys. And I'm going to highlight some of the patient results first. Hopefully you can see this up here, but this slide shows the various legal and resource needs that patients identified as having experienced over the course of the past year. The most commonly reported issues were related to personal finance issues, so being sued or harassed by a creditor, missing rent or mortgage payments, missing meals because of inability to pay for food. And I think, given this information, health centers should consider developing in-house or perhaps referring to existing community resources that would promote financial literacy and also facilitate access to free or reduced cost food. But I also want to highlight that not everything on this slide is a legal need. Some are resource needs. But we wanted to ask about both legal and resource needs because resource needs can become legal needs. So for example, a patient with credit problems may need to be may need credit counseling. But if they're being sued by a creditor or undergoing mortgage foreclosure, they may need legal help. And because community health centers commonly staff social workers and case managers, it's really an ideal partnership because the social worker case managers at the health centers can address the social resource needs and then refer to the legal team when they need to. Overall, the patient data really underscored the need to develop medical legal partnerships in community health centers. I think the most telling result was that the sickest patients, those who reported fair or poor, very poor health status, were the most likely to report having experienced a legal or resource need. They were also least likely to have ever sought legal assistance in the past and least likely to know where to go for help. This was the same for Hispanic Latino patients and highlights the need to direct and do some specific outreach to this population and connect them to legal resources. But promisingly overall, patients were willing to talk to their providers about these issues in the future. So it's a service that patients would utilize. Moving to the staff survey results, this chart shows the percent of patients reporting the various legal resource needs, and then the percent of staff who are comfortable talking about those issues and comfortable and likely to screen and refer. So if you can see on this chart, the majority of staff, or in all cases, staff were more likely to screen and refer patients than they were necessarily comfortable talking about those issues with patients. So with training, we feel like medical legal partnerships can improve staff's comfort level discussing legal resource needs with their patients, and then also, thereby increasing their likelihood of screening and referral. And I think this is really important because, as you can see in this first category, staff were least comfortable talking about harassment by creditors, and this was the most commonly reported issue from patients. Overall, 71% of staff said that they would screen and refer patients for free legal assistance. Social workers and outreach workers were the most likely to screen and refer, and this reflects a trend nationwide in medical legal partnerships. Social workers tend to have the most communication with the legal partner, and again, this is really an ideal structure because the social workers can address those social resource needs and then refer to the legal team when needed. Staff with shorter tenures, perhaps not surprisingly, were more comfortable talking about these issues and more likely to screen and refer. So we may need to do some targeted training for staff in health centers based on this information. And we also asked about what staff perceive to be barriers to addressing health-related legal needs, and hope to, again, develop some training and modify programs to help reduce some of these barriers. So our key takeaways, I think, are summarized in these 4 points. The fact that health center patients do have a large percentage of health center patients have unmet legal needs. The sickest of those patients are more likely to have those needs and less likely to seek help, or less likely to know how to seek help. Patients are willing to talk to their providers, and providers are willing to screen and refer. So knowing this, moving forward, I've highlighted some of our short-term steps, but given time, I'll just talk about the longer-term steps. NCCHCA and legal aid are committed to collaborating on developing a statewide or regional approach to expanding medical legal partnerships in community health centers. And we particularly want to target rural areas. Most of the medical legal partnerships in our state are in urban areas currently. So we see a real need to expand and help provide this service in parts of our state that struggle with access to services. As part of this approach, we've also discussed developing a centralized resource that, for example, all community health centers could use, or maybe the broader safety net, something like an MLP coordinator that could connect practices with legal aid and provide training to participating healthcare partners as well. And we also have talked about this MLP coordinator could work to identify additional legal partners in communities. Legal aid is a legal services corporation funded program, and along with that funding, they face some restrictions on the types of cases they can handle and on who is eligible for those services. So we need to make sure that there's a network of additional partners that we can connect community health center patients to. We do intend to apply for some grant funding to support initial program planning and implementation, but over the long term, we expect that medical legal partnerships and health centers will be sustained through a shared investment from legal aid and from the health centers alike. And I truly feel that health centers are motivated to engage in these types of partnerships for a number of reasons, and not in any particular order. But one, because of the opportunity to increase revenue if, for example, they're able to connect patients to health insurance after those patients have been denied.